Hello everyone, this is Tamer Seckin. We are at Sao Paulo, Brazil, at the Brazilian Endometriosis Society and ISG joint meeting. We are here today with the president of ISG, Dr. Steffano Bettocchi. I'd like to, he needs no further introduction because Steffano is the name behind his own hysteroscope and wonderful design, and with his innovation we all follow his footsteps. Steffano, congratulations, this was a great presentation today, but as a president this is the first time I have honor to talk to you. I think our viewers around the world, the new gynecologists, aspiring endoscopists, are looking to hear from you, because our society, I know and we all know, is about to leap to another growth period. We all see this happening under your leadership. So I want you to really take it from here, give some message and see what you will say.
Thank you, Tamer. So, as you know, ISG is voted for an international partnership. So we are trying to grow up and to become more and more international. Certainly we will, as I said yesterday during the presentation, we will change slowly our skin, and we are looking for a big partnership. So probably the next year, the next 2 years will be the most hard years of the society. I hope, with the help of all the members, to move the society to really high levels of scientific levels, and also, why not, economical levels, in order to facilitate all the operation, all our activities. And certainly another big step will be to have a very professional teaching program. Will probably start from next year, who will allow so-called underdeveloping country to afford the teaching and the creation of a group of specialists in order then to promote in their own country the field of gynecological endoscopy.
Am I hearing that we are sticking to our mission? We bring advanced laparoscopy home where our members are.
Yeah.
And we will right now organize, as I understand, into specialized groups that would do teaching in prepared way with the support of the technology.
Yeah, we have always to look to our mistake. Probably one of the mistakes, not of our society, but of the whole society around the world, is that they don't take too much care of their members. So we decide, as I told you, to change our behavior and be more and more close to our members. And this means not only to send them information, but also to involve them in our activity and to spread all our knowledge, all the knowledge of our members in a country where this request is quite high. So that's the reason why we are moving on with this program. It will be quite innovative, I hope.
You can cut it. All right. Okay. We are continuing with Steffano Bettocchi. He had a great presentation of his almost specialized topic, office hysteroscopy. Steffano is the man and the brain behind Bettocchi office hysteroscope, which we have seen wonderful things today. What is wonderful about it? It is his new way of doing. For the years I have watched him in China doing this, touchless, without touching, using any speculum, no tenaculum. He can go vaginoscopy and finds the cervix and goes inside. And Steffano, how did this technique really develop?
This is, this technique belongs from observation and examination of the new technology were available at the time we thought about this technique, and this technique is always under development. So we change always something depending by the new technological improvement arriving from the company, we receive from the company. So the technique is mainly voted to reduce the pain and the discomfort for this kind of procedure. When we talk with ladies and we said, oh, you have to undergo hysteroscopy, they say, oh Jesus, I heard from my friends, I saw that it's quite painful. I always explain to the lady, it was painful in the past, probably your friend did it in the, let's say, classic way. So we are trying to reduce the discomfort for the patient. So having a better approach. And obviously, if the patient feels comfortable, the doctor will feel comfortable, and probably he will put more efforts in the technique. So it's a way to grow and to move this technique from the field of, let's say, invasive procedure to the field of no-invasive or minimal invasive procedure.
You have shown us that even with the smaller, almost stenotic cervixes, you can go in without any problem with the flexure of the uterus, I guess. You can go in and visualize, even operate. What's the smallest? Your diameters, I understand, is 4.5 millimeter?
No, the latest instruments we present on the market reach finally less than 4, so 3.75 millimeters. So it's, if you consider that up to 10 years ago, the minimum size was 5 millimeter, so we are reducing about 30-35% the amount, the size of the hysteroscope. And probably for who is not expert in anatomy, 1 millimeter or 2 millimeter means nothing. But if you consider that the cervix, the internal cervical os, is the critical place where we have to pass through, it's 5 millimeter. To decrease of 2 millimeter means to decrease of 35-40% of the size also.
And you do not use any sedation for this?
No, absolutely not.
Absolutely not. And you can tell us what, besides diagnosis, we've seen you doing some procedures. Tell us those procedures.
As I said this morning, we don't distinguish anymore between diagnosis and diagnostic and operative procedure. It's a so-called see and treat. You go in with your scope. It's like laparoscopy. When you go in and you see, I don't know, a cyst, endometriosis, whatever, what do? You stop the procedure and you go back with another scope. No, you are already prepared, ready for the surgery. This is the same concept we apply to hysteroscopy. You go in, our scope has an operative channel, and through this channel we can insert instrument, mechanical, bipolars, and perform surgery.
Wonderful. And Steffano, how can people reach to your website? What's your address?
The website is www.hysteroscopy.org. It's under reconstruction, but it's anyway available for just to have a look, and then they can easily contact me on the email. It's reported on the website.
Thank you for your
Thank you very much.
Thank you.